Hello there. I just watched your video, Sicko review. It was very interesting the way you did it, considering the fact that it was your first video. But I would like to give you a little bit of information about socialized medicine that we have here in Canada. I am working within that system myself, and I am also a client of that system. I was trained as a specialist in the United States at Temple University. I had the opportunity to work within the United States and migrate there, but the girl that I met, whom I eventually married, was a Canadian and she wanted to go back home. So I ended up in Canada, and I have seen the medical system in the United States as well as in Canada. One of the things that really turned me off in the 70s was the fact that people who had insurance got the best possible medical care, and people who did not have insurance or had partial insurance got the worst medical care. In Canada, things are quite different. Canada has a number of provinces. Each province runs its own health insurance scheme. The health insurance scheme run by each province, or you can call it each state in Canada, is run by the government. It's a government-run corporation. It does not make any profit. It does not have a lot of bureaucrats like we have in the United States. It does not have many bean counters. And as a result of it, the cost of healthcare is reduced considerably. Of course, they also want to make sure that there is no duplication of services and excessive amount of equipment to do unnecessary MRI scans and so on. So in a way, there is some rationing of healthcare. So as a physician, if I have to order a test on a patient, I would order it by thinking about it first, making sure that the test is appropriate for this particular individual, and I'm getting the biggest bang out of the buck. The healthcare is no inferior in Canada compared to the United States. We use almost all your technologies that is available. But one thing that is not there in Canada is duplication of services. We do not have hospitals competing with each other. And as a patient, I can choose my own family doctor, and if I need a specialist care, then the family doctor has to refer me to a specialist. In other words, after consulting with my family doctor, I can go and see a specialist. So I'm not that way the family doctor makes sure that I'm not wasting the time of the specialist or overutilizing that services. Under the government scheme, everything is covered, from hospitalization to treatment. The only thing that is not covered is your pharmaceutical medications. While you're in the hospital, you will get it for free, but once you're out of the hospital, you would have to buy your own medications. But for that, we do have a private insurance scheme run by private insurers, which basically cover things like dental. They cover things like reading glasses, braces that if you might need. They will cover things like physiotherapy or chiropractic treatment. But again, the number of chiropractic treatment and physiotherapy treatments that are allowed under the insurance, private insurance scheme also is limited to so many sessions. So even the private insurers also want to make sure that there is no overutilization of medical resources. So that's how it works. I do not pay any insurance, any insurance premium, I should say, for my medical care as far as the government is concerned. The only thing for which I pay is for the private insurance, which includes, as I mentioned, glasses, eyeglasses, hearing aids. I hope I don't need to get one. Getting old. It will also cover, if you really want a private room or semi-private room, it will cover that. But oftentimes in the hospital, the number of beds are limited. So even if you have private coverage for a private room, you may not necessarily get it. Though if I was seriously ill, I would prefer to be in a general area rather than in a private room, personally. So that you are always under the watchful eyes of the nurses. So that's how the situation here, it works out very well from the point of view of the patient. It also works out well from the point of view of the physician. As a physician, I do not make a lot of money like they make in the United States, but at the same time, I don't get sued very often like they do in the United States. I have never been sued thus far, knock on wood. But for doctors to insure themselves against lawsuits, we have an institution called the Canadian Protective Association, which is an insurance company run by the doctors for the doctors. And this particular company is pretty tough. It will never settle out of court. So a patient who wants to sue a doctor has to make 100% certain that there is a good case for them to sue the doctor, and they are 99% sure that they're going to win it. And the lawyers also understand that very well. We do not have a surplus of lawyers like you have in the United States. In my view, one of the things that is driving the healthcare cost in the United States high is duplication of services. Again, doctors are forced to practice very, very defensive medicine because of the threat of being sued. And of course, they are protected from lawsuits by insurance, but those insurance companies are privately owned and are for profit, and oftentimes will settle frivolous cases outside the code, which again adds to their costs. So in addition to that, the politicians in the United States like to keep the public in the dark with respect to the merits of a healthcare system like we have here in Canada, because the lobbying that you have from the insurance companies that insure for healthcare, the lobbying that you have from the drug companies, that's what drives the cost up. Anyhow, thank you for listening.